What's up, guys? This is Nurse Sam back at it again. So just kind of like the title says, what is a nurse case manager? I made a video about this already, but I just kind of want to expand on this subject because a lot of people don't know what a nurse case manager is. When I started off my nursing career, and just kind of to give you some background information on my nursing career and how it began and how I got myself into how I got myself into case management. All right, so when I graduated from nursing school in Los Angeles, I started my career as a nurse on the medical surgical floor. And those of you guys who have worked on the medical surgical floor know that the nurse to patient ratio is 1 to 5. And so I would, on the med surg floor, I would take care of 5 patients every day that I would come into work. And I did that for about, I want to say about 3 years. And honestly, guys, it's a lot of back-breaking work for me. At least for me, it was. As a guy, all the other nurses, all the other female nurses on the floor kind of tell you like, hey, Sam, you're a man, you're a guy, can you help me roll this patient over, or can you help me pick this patient up, put him on the bedside commode so that, he can obviously toilet and do the number 2. So after doing that for a while, my back started to give out, and I started having lower back issues. And so I knew from that instance that I wouldn't be able to last long as a nurse if I continued to do bedside patient care. And honestly, guys, I just was looking for something different because there's instances where you get patients that just kind of mistreat you, disrespect you after, as a nurse, you're just being nice and polite, trying to help that patient get better. You feel like you're just not being valued, or you feel like you're not being appreciated by your patients. There's instances where I would come into like the bedside, and my patient would be complaining of pain, and I'd come in to the bedside with the pain medication and be like, here, so-and-so, I got your pain medication. And the patients would just be like, give me my pain medication, F you, and get the hell out of my room. And I'd be like, dang, man, like, really? I just gave you pain medication. I'm trying to help you get better. I'm trying to take your pain away. And that's how you're going to treat me? And so I was just like, I don't like being disrespected like that. And, it's not all patients that treated me that way, but it's just, what I mean? There's those few patients that just kind of, throw your whole day off. And obviously I try not to let that get to me, but after a while, it just kind of, you almost feel like a servant. You feel like a human slave. And I'm just being real with you guys. And so I was just like, man, I really don't like that feeling of like servitude. Even though I don't mind doing nice things for people and being polite and all that, but there's those few patients that just kill it for you and just throw your whole mood off. But anyways, the nice thing about nursing is that it's so broad, and if you don't want to work in one department, you can move to a completely different department. And so I didn't see myself doing patient care for the rest of my career. Especially, I like to stay clean. I like to stay clean cut. So wiping butts and working with wounds and, getting urine all over yourself and working with blood and stuff like that was just kind of not my thing. Walking into rooms and smelling C. diff, it's just, after a while, it's just like, yeah, I'm trying to stray away from this area. And don't get me wrong, that's essentially what nursing really is. And there are people that love that aspect of nursing where they just do a lot of hands-on patient care. But for me, honestly, guys, that's not my thing. That's not my style. Like I said, I like to stay clean. I like to dress nice and be able to show up to work and just kind of just do my work and not have to, deal with all the extra stuff. And so the nice thing about case management is that most of the work in case management is basically just, mainly sitting behind a desk, coordinating care behind the computer, using the phone, speaking with members of the interdisciplinary team. And so how did I find out about nursing case management was, well, funny thing is, while I was working on the floor, I would see people nicely dressed in their button-up shirts, or women in nice dresses or nice business attire, walk past me with their RN badge hanging out in front of them. And I was like, wait, what? They're an RN as well? But why are they dressed differently? And why are they not doing the same things that I was doing? So I actually stopped one of them. And this nurse case manager, her name was Laura. And I was like, and I asked this nurse case manager, Laura, I was like, hey, so what do you do? I see that we both have the same educational background. We both are registered nurses. However, you're doing something completely different than what I'm doing. And so I started asking her questions. So what exactly is a nurse case manager? And we both sat down, and basically, what she was telling me really interested me. And I said, I feel like I could really gravitate towards that. And so I applied for a position in the hospital to be a nurse case manager. And sure enough, I got it. And ever since I became a nurse case manager, let me tell you guys, I fell in love with it. It was nice. I wasn't being mistreated by patients. I didn't have to clean or wipe butts. I didn't have to smell poop, C. diff, no urine on me. Didn't have to work with blood, needles, syringes. I felt like I was in heaven, guys. And I said, I can do this for the rest of my life. Thank you, God, and thank nursing for being such a huge and broad career that you can just jump from place to place. And so I just fell in love with nursing case management. All right, guys, so let me tell you what nursing case management entails. So a nurse case manager, basically what we do is we coordinate care. We do what's called discharge planning. So let's say a patient gets admitted into the hospital and they get diagnosed with COPD, chronic obstructive pulmonary disease, and it looks like they're going to need oxygen going home. And so as a nurse case manager, I assess the patient. I say, okay, so-and-so, this is your name, make sure the, date of birth. I verify their address, where do they live, what kind of medical equipment do they have at home. And if this patient says, hey, I don't have any oxygen at home, a light bulb should go off and tell you, okay, this patient just got newly diagnosed with COPD, they're gonna need oxygen. Okay, let me talk to an oxygen vendor, an oxygen company, see if they can come and deliver the piece of oxygen equipment that the patient's gonna need over to their home. So what I'm gonna have to do is make sure that we have a correct address for the patient on file, and then I provide that to the company and say, hey, this is the patient's address. They're gonna need oxygen going home. Can you deliver it on this date? Because this is the day that the patient will be going home. This is the day that the patient will be discharging. So that's an example of what we do with regards to discharge planning. Another example is maybe a patient just had a hip fracture, and so they just did a surgery on the patient, or the patient had a bad knee and they did a knee replacement. And let's say the patient is in the hospital, they're working with physical therapy, and they're progressing slowly, they're still not at their baseline, and they still need assistance, and the patient still requires more physical therapy. Obviously, in the hospital, we try to keep our length of stays as short as possible, so that we can stay within Medicare guidelines. But anyways, we see that this patient needs more physical therapy. So what we do is we talk to the patient, hey, so-and-so, there are rehab facilities outside of the hospital that we can send you to, so that you can continue getting the physical therapy that you need. And then once you get to your baseline being at those facilities, then they can send you back home, and then you can get back to your normal life. And so those are one of the things that we do. Or also what we can do is, if the patient just needs a little bit of physical therapy, then we can think about sending, and this patient maybe has a family member that can help them at home, then we can say, hey, patient so-and-so, you can go home, and it seems like you have some family support to help you out with your activities of daily living, such as cooking, cleaning, using the restroom. Looks like you have assistance at home from your family member or friend. We can also, however, set you up with home health. And home health offers different types of services, just such as physical therapy, nursing, occupational therapy, speech therapy, and also some social worker services, and also home health aid. So we can say, hey, so-and-so, we can set you up with the home health agency, and they can provide physical therapy services. Obviously, you want to talk to the doctor and have them order these services. And then once you get the order for these services, then you can contact an agency that provides these services, and then just coordinate the services for the patient. Another thing that we do for the patient is, in terms of discharge planning, is we do what's called acute transfers. So let's say a patient is admitted to your hospital, and the patient's going to need a kidney transplant. However, your hospital is a small hospital, it's a small rural hospital, and you guys are unable to provide those type of surgical services. So as a case manager, it's going to be my job to try to coordinate, try to look for surrounding hospitals that can provide those services and are able to do the renal transplant. So so then what I would do is touch base with the hospital's transfer center and say, hey, we got a patient here. Patient's gonna need a renal transplant. Is there a doctor, a surgical? Do you guys have a surgeon, a doctor that can accept this patient and be able to perform the surgery? And then we just kind of exchange, the patient's clinical information. That way, both hospitals are well aware of the patient and know what's going on, and then they can take the patient on from there. And obviously, I would set up transportation once we have an accepting doctor, once they have a room for the patient, and once the patient is in agreement with going. So those are some of the things that we do as discharge planning. So there's a lot of things that are involved in discharge planning and in case management. Also, as a case manager, you want to be aware of Medicare and their guidelines. For instance, you want to be familiar with Medicare Part A, Part B, and those different things. Also, as a case manager, we do what's called a utilization review. What utilization review is when a patient comes into the hospital, we try to, and they're in for 3 days. Let's say they're in the hospital for 3 days. We try to use a guide which is called InterQual, and this InterQual guide has been approved by Medicare. And so if a patient's a Medicare patient, we use InterQual to determine whether this patient is their stay in the hospital is justified, medically justified. Okay, so if a patient, the InterQual guide will also tell us, like, hey, patient doesn't meet inpatient status, they should be discharged already. What are they still doing in the hospital? And so we kind of touch base with the doctor. Hey, doctor, looks like patient's not meeting inpatient stay criteria anymore. Are we planning for discharge anytime soon? What's going on? And the doctor should be able to give you some justification for why we're keeping them there. And the doctor will obviously, write in his progress notes the reason for why the patient still remains in the hospital. So those are some of the few key things that we do as nurse case managers. I hope you guys learned a thing or two from this video. Case management is pretty broad, but I think after a year of doing it, you the wheels start turning, and you just start getting the gist and the idea of what nurse case management is. I really like it. Like I said, I don't have to smell poop. I don't have to work with blood. I'm just going to be real with you guys. I don't have to work with patients cussing me out. I'm not there like 24/7 at the bedside, which is nice. I'm basically just behind a desk, coordinating care, documenting, doing patient assessments in terms of, getting their basic demographic information. Where do they live? Do they have any family support at home? Do they have any medical equipment? And if they need medical equipment, I at least know what they already have at home, so I can know what I need to order for them. So those are some of the things that we do as nurse case managers. I hope you guys like this video. If there's a specific topic that you want me to talk about, let me know. But like I said, I've been a nurse case manager for a few years now. I really enjoy this job. I see myself here for a pretty long time. And yeah, if you guys are thinking about being nurse case managers, I highly recommend it. If you're trying to stray away from doing direct patient care, I've enjoyed it. I know that most of the nurse case managers in my that I know are usually older than me. I'm probably the youngest nurse case manager in my department right now, but I think a lot of people just are not aware of what exactly nurse case management is. I think a lot of the younger nurses just kind of feel intimidated by it because they probably feel like it's too much administrative work and just too much politics or something like that. But it's actually a pretty cool, nice job. I hope this video helped you guys in terms of trying to grasp the idea of what we do as nurse case managers. Well, anyways, if there's a specific topic you want me to talk about, comment in the comment section below. Like this video if it helped, and if it didn't, put a thumbs down. Hope you guys have a good rest of your day. My name is Sam, and I'm out.